So, good morning, everyone, and welcome to this session on the adductor compartment of the thigh. Adductor or medial compartment of thigh. So, basically, this is along the medial side. So, these are our two legs. We are talking about this portion, the muscles. There are special muscles which bring about the adduction so that our two legs are absolutely by each other's side. So these are the muscles which are called as adductors. Their names are very easy to remember because three of them are adductor longus, adductor brevis, brevis means short, and adductor magnus. Magnus means large. So longus is long, brevis is short, magnus is huge, bulky. Apart from these muscles, there are two other muscles, gracilis and pectineus. Gracilis and pectineus. Pectineus, now you must have realized, pectineus and adductor longus, these two muscles are there in the anterior compartment as well as the medial compartment. Gracilis is the medial most of all of this. So if you see the hip bone, especially the pubis from the external aspect, on the pubis, we see origin of adductor longus like this. Okay. Then there is origin of adductor brevis. So this is adductor longus, adductor brevis on the pubis on the external aspect. This is the obturator foramen. Then this is the origin of most medial muscle, that is gracilis. And then there is this huge origin of adductor magnus. Now adductor magnus also belongs to two compartments. It belongs to hamstring compartment as well as adductor compartment. So this belongs to two compartments. It is adductor plus hamstring compartment. So these are about the origins of all of these. There is obturator externus muscle around the obturator foramen of the hip bone. Obturator externus muscle. As regards the insertion of all these muscles are concerned, the insertion are mostly on the posterior surface of the femur. The posterior surface of femur along the linea aspera, there is insertion of adductor longus, then adductor brevis, and adductor magnus. Okay. Now the gracilis gets inserted on the upper part of the tibia. Now this is the medial side, this is the lateral side, this is the posterior surface of tibia. So on the tibia, along the medial side, there are three tendons inserted, SGS. Okay. Amongst them, the gracilis is here. The gracilis is on the medial surface of the upper part of the condyle of the tibia. So gracilis insertion is on the tibia along with sartorius, gracilis, and semitendinosus muscles. So these are about the origin and insertion of these muscles. These muscles are supplied by a nerve, which is the nerve of the medial compartment, obturator. This obturator nerve has a root value of L2, L3, and L4. Now you may say that femoral nerve also has the same root value, L2, L3, L4. So what is the difference? Femoral nerve was from the dorsal divisions because it supplies the extensors, while obturator nerve is from the ventral divisions of L2, L3, anterior primary rami, ventral divisions of the anterior primary rami of L2, L3, and L4. Okay. So nerve supply of all these muscles is by the obturator nerve. Their actions mainly are adduction. Mainly their actions are adduction. The adductor magnus may slightly, help in the extension of the hip joint. Gracilis is a strong adductor. Rather, if these are our two limbs, one gracilis is here, other gracilis is here. So it is the muscle which causes adduction of both of our limbs. Okay, both of our limbs, they are adducted by the gracilis. Gracilis muscle, it causes adduction. Now let us see the obturator nerve, its course and its relation. Whenever we write any nerve, we write the root value L2, L3, L4. This is not sufficient, so we say ventral divisions. Ventral divisions normally supply flexors and adductors. Dorsal divisions supply extensors and abductors of the anterior primary rami of L2, L3, L4, and it is a branch of the lumbar plexus. Femoral nerve was also branch of lumbar. So after it takes origin from L2, L3, and L4. Now let us define first our sides. Suppose this is the lateral side, this is the upper side, this is the lower side, the superior side, inferior side, medial is, this is in the midline only. So they take origin from L3, L2, L4. And this muscle, femoral nerve, was lateral to psoas major. This nerve is, this is the psoas major muscle. So this nerve is medial, it runs medial to psoas major. Medial to psoas major muscle, runs medial to the psoas major muscle in abdomen. So that is the course in the abdomen. Then what happens? It enters the pelvis. It enters the pelvic brim. Okay, enters the pelvic brim. So it enters pelvis. Now what happens in pelvis? In the pelvis, it is lying in the, this is the ovary. It is lying in the lateral wall of ovarian fossa. Lateral wall of ovarian fossa. And then it comes out through the obturator foramen. It leaves the pelvis by passing through obturator foramen. Obturator foramen is this foramen of the hip bone. Okay, so from there it comes out. So it leaves pelvis by passing through obturator foramen. And by passing through obturator foramen. And then it enters the adductor compartment. Enters the adductor compartment, the medial compartment. Now here I am changing the orientation of the diagram. Here there was superior, medial, lateral. Now I am changing the orientation of the diagram in this region. This is superior, this is inferior, this is anterior, and this is posterior. Okay. So it divides into anterior and posterior division. Anterior and posterior division in relation to, divides into anterior and posterior division in relation to adductor brevis. Adductor brevis muscle. So adductor longus is anterior to. So it supplies adductor, anterior division supplies adductor longus. It also supplies pectineus. It also supplies gracilis. Also supplies gracilis. The posterior division, as it is coming out actually, that is, it is coming out, this distance should be shown little shorter as it is coming out it of the obturator foramen. Of the obturator foramen. It also supplies the obturator externus. And then it supplies adductor magnus. That means posterior division supplies two muscles, obturator externus and adductor magnus. Anterior division supplies adductor longus, pectineus, and gracilis. Okay. Now, adductor brevis may get supplied by anterior or may get supplied by posterior division. So that depends. Anterior division also supplies the hip joint. Posterior division goes down, gives branches to the subsartorial plexus, and it mainly supplies the knee joint. So anterior supplies the hip joint and posterior supplies the knee joint. Okay. So we'll again revise the obturator now. Obturator now, which has a root value of L2, L3, L4. It arises from the ventral divisions of the anterior primary rami of L2, L3, and L4, some of the lumbar plexus. It starts from the lumbar plexus. Runs along the medial wall of the psoas major. That's the course in the abdomen. Then it enters the pelvis by passing over the pelvic brim. This is the pelvic brim. It enters the pelvis where it lies in the lateral wall of the ovarian fossa. Leaves the pelvis by passing through the obturator foramen. And then divides into anterior and posterior division. Immediately divides. This distance can be drawn little shorter because obturator externus is around this opening. Anterior division is anterior to adductor brevis. Posterior division is posterior to adductor brevis. Anterior division supplies adductor longus, pectineus, gracilis, and adductor brevis if not supplied by posterior. Posterior division supplies obturator externus. It supplies adductor magnus and adductor brevis if not supplied by anterior. Now coming to the applied anatomy. The applied anatomy of the obturator nerve. As it supplies both hip and the knee, pain of the hip may be radiated to the knee, or it can be vice versa. Two, because it passes through the lateral wall of the ovarian fossa. Because it passes through the lateral wall of ovarian fossa, what happens is a female may have some ovarian swelling which may be radiated to the medial side of thigh. Okay, and in case of this is one pain of the hip and knee getting referred to each other. Right, it passes to the lateral wall of ovarian fossa, and there may be ovarian tumor, ovarian enlargement, which is pressing on the obturator nerve. And female may just come to you saying that there is pain along the medial side of thigh, and medial side of thigh may appear normal. But if you have read anatomy properly, you will realize that this may be a pain because obturator nerve is supplying this medial side of thigh, and it is getting pressed because it lies in the lateral wall of the ovarian fossa. So ovarian swelling is pressing upon it. 3, in case of adductor spasm, we sometimes cut this nerve to relieve the path. So here we see that nerve is passing in the lateral wall of ovarian fossa and it goes in. Now, when we talk about the branches, of any nerve, we said we use the formula MAC. So here the muscular branches: anterior division, posterior division supplying adductor longus, pectineus, gracilis, and adductor brevis. Posterior division supplying obturator externus, adductor magnus, and adductor brevis. Articular branches: anterior division supplying the hip joint, posterior division supplying the knee. Cutaneous branches, it supplies the medial side of thigh. And vascular branches, it supplies the obturator vessels. It supplies the obturator vessels. So this is all about the obturator nerve and the medial compartment of the thigh. The artery of the medial compartment is medial circumflex femoral artery, which is a branch of profunda femoris artery, which is a branch of femoral artery. Femoral artery is a continuation of external iliac artery which is a branch of common iliac artery, which is a branch of abdominal aorta, which is a continuation of thoracic aorta, which is a continuation of arch of aorta, which is a continuation of ascending aorta, which arises from the left ventricle of the. Thank you so much.